Much. Happening today, St. Louis County Executive Sam Page is expected to announce new restrictions in response to a growing number of COVID-19 cases.
Yeah, the county has reported a record number of cases in the last several days. News 4's Caroline Hecker joins us live in Berkeley this morning, where Dr. Page will unveil the new restrictions this morning. Hi, Caroline.
Well, good morning. You're right. That growing number of cases, not only in the St. Louis metro area, but in St. Louis County specifically, is concerning, according to Dr. Sam Page. So much so that he says with help from local health experts as well as his pandemic task force, there will be new restrictions that will be put in place in St. Louis County to help curb or at least stop the spread of the virus. Now, that spread, he says, primarily is community spread, meaning people just not abiding by social distancing and or not wearing a mask. Now, last week, the county alone reported about 2,200 new cases. That's about a 90% increase over the previous week. Now, also important to note for context, when you look at the entire month of June, the county reported about 1,600 cases and 128 people died. That's about an 8% mortality rate. But if you look at the month of July, we've seen nearly 3 times the number of cases, and the death rate sits at about 1.5%.
The hospital admission rate is getting close to that 40 admissions per day mark that we had set several weeks ago as the point where we would start talking about more restrictions.
Now, Page says it will take 2 to 3 weeks to see any potential benefit that would come from any kind of restriction given the 14-day incubation period of the virus. So again, just to be clear, there have been no specifics released by Page's office as to what these new restrictions will be. All we know at this point is that at that 10:30 press conference he will hold here at the County Health Department, he will unveil what those new restrictions will entail. We're live in Berkeley this morning. Caroline Hecker, News 4.
Caroline, thank you.